Hello everyone, today we are going to present a poster on obstructive sleep apnea and its management. Let's see what is obstructive sleep apnea. Obstructive sleep apnea is a sleep disorder that involves cessation or significant decrease in the airflow in the presence of breathing effort. Let's see the causes of obstructive sleep apnea. The daytime drowsiness, hypertension, heart attack, stroke, memory loss, diabetes, depression, insomnia and early death. Let's see the pathophysiology of obstructive sleep apnea. Increased breathing effort. As the oxygen level decreases and carbon dioxide level increases, the body's response is to increase the breathing effort, attempting to force the airway open. The brain triggers the aerosol or brief awakening to restore the muscle tone in the airway, which temporarily reopens it. During aerosol, there is a rapid increase in the upper airway dilated muscle activity, allowing the airway to open again, which leads to hyperventilation state. Hyperventilation reduces the carbon dioxide level and increase oxygen level in the blood. With the normalized oxygen and carbon dioxide level, the individual returns to sleep, but the cycle repeats multiple times per night due to repeated airway collapse. So, reduced upper airway muscle reactivity increases the upper airway resistance, resulting in reduced lung volume, which leads to hypoventilation state. During sleep, the muscles that keep the airway open have reduced activity in making the airway more prone to collapse. Narrowing and collapsing of upper airway, which ultimately leads to obstructive sleep apnea. Let's see the dental risk factor in obstructive sleep apnea: macroglossia, bruxism, dental caries, periodontal problems. Let's see the systemic risk factor in OSA: hypertension, diabetes, obesity, neck circumference and waist circumference. Next, we're going to see about the management of obstructive sleep apnea. We have behavioral modification, non-surgical modalities and surgical modalities. Behavioral modification includes weight reduction, avoid CNS depressant, tennis ball and back, stop smoking. Next, we're going to see about this continuous positive airway pressure. The most common and effective device provides a constant flow of air through a mask, keeping the airway open. It acts as a pneumatic splint to maintain the patency of the pharyngeal airway by preventing the collapse of the pharyngeal tissues. Next, we're going to see about the tongue repositioning device. The tongue repositioning device are designed to treat snoring and mild to moderate obstructive sleep apnea by holding the tongue in forward position during sleep, thereby preventing it from blocking the airway. This device works by creating a space in the mouth to keep the tongue in a stable position and preventing it from falling back and obstructing the air passage. Next, we're going to see about the palatal expansion device. The palatal expansion device is used to increase the volume of the oropharynx and reduce the airway collapse, which is the common cause of obstructive sleep apnea. By enlarging the space at the back of the throat, airflow obstruction can be minimized or eliminated. The palatal expansion device works by either physically expanding the soft palate or providing support to preventing it from collapse during sleep. This can be achieved through surgical procedure, oral appliances and other devices. Next, we're going to see about the mandibular advancement device. Mandibular advancement device are designed to treat the snoring and obstructive sleep apnea by advancing the lower jaw forward, and during sleep this forward positioning helps to prevent the collapse of the upper airway and promotes improved airflow. Next, we're going to see about the surgical procedure to treat the sleep apnea. First, we're going to see uvulopalato-pharyngioplasty. The procedure removes the excess tissue from the soft palate, uvula and pharynx to wide open the airway. It is suitable for the patient with a soft palate obstruction. Next, we're going to see about the tonsillectomy or adenoidectomy. It is a procedure to remove the enlarged tonsil or the adenoids that obstruct the airway, common in children with OSA due to large tonsils and adenoid. Next, we're going to see the hypoglossal nerve stimulation. It is the procedure, the implant a device that stimulates the hypoglossal nerve and causing the tongue to move forward during sleep and keep the airway open. Next, we're going to see about the hyoid bone suspension. In this procedure, repositioning of the hyoid bone to stabilize the airway. Indication: it is used for patients with multiple levels of airway collapse. Next, we're going to see about the tracheostomy. Creates a direct opening in the trachea for breathing. It is used as a last resort for severe life-threatening OSA when other treatment fails. It is highly invasive and requires long-term management. Next, we're going to see about the tongue reduction surgery. It reduces the size of the tongue to minimize the airway blockage. indication for the patient with oversized tongue contributing to OSA. Finally, we conclude by saying that the aim of all these approaches is to improve the patency of upper airway by increasing its dimension and decreasing the collapsibility. Thank you.